Hi, I'm Dr. YVRao, plastic surgeon from Dr.YVRao Clinics, Hyderabad and Vizag. A few words about female genital rejuvenation. Before knowing female genital rejuvenation, so what constitutes the female genitalia, especially for rejuvenation process, are mainly if you divide them into external, internal, and the structures, uh, two things. External parts, that is what we see immediately at the in the groin region, is that is labia majora, that is the outside prominent elevations, and labia minora, which are thin flap-like things in between the majora. So these are called labia minora. So these two are the external parts that we see. The moment we open or spread these two, there is a membrane-like thing called the hymen. So hymen, and beyond this hymen is the vaginal cavity. So these are the the female genital organs, which are usually come for rejuvenation for a plastic surgeon. So in this case, what we have to do is in female for a labia majora, the most of the times over the age, these people do come around middle-aged people or a little elderly people, or they come for rejuvenation of the majora. Whereas younger patients, they do have prominence of the labia majora, and usually they are not bothering about. So most of the patients that come for labia majora rejuvenation are all beyond middle age. So what the changes with age that occur is they be atrophied. That means the loss of volume. They get flushed with the rest of the groin. So to give prominence, what we do is we do a fat grafting. That is, we take fat from the abdomen or the loin and then inject that pure fat, if necessary in one sitting, or if necessary we may have to give second or third time also. But usually 2 times are more than enough. And for the small regions like labia majora, even once may be enough. For labia minora, what happens with the age is it gets the thinned out and stretches also, and then increases in size. What happens because of this? What happens? There are 2 minor side effects, or rather, I can say inconvenience that occur with the excessive tissue of the labia minora. One is while riding bikes or while sitting. What happens is these two are sitting also, and even in normally they get caught with the undergarments or in between the thighs, and then they produce a traction pain on that area. And also during the intercourse, what happens is these flaps, they go in and out of the vaginal cavity and then produce a traction, and they may induce pain also. For these 2 reasons, the ladies do approach for rejuvenation of the labia minora, that is the flap-like things which are in between the majora. So what we do is, in fact, we remove that excess portion of the by leaving about approximately 1 to 1.5 centimeters of the labia minora, and then leave the excess part from the above to down, that is from anterior to, in medical language, to posterior areas, and then suture with absorbable sutures. So what the hymen reconstruction, the thin membrane like thing is a hymen one. So hymen reconstruction, most of the people that approach are usually youngsters, that is are just before marriage. So what happens is this hymen is a thin membrane which varies in structure in different people and in different ethnic structures also. So this hymen is normally supposed to be a thin membrane with a small opening which opens up especially during the puberty time, for the menstruation to come out. This is a protective layer in the younger age group. With age, what happens, or for various reasons, unknown reasons also, or with exercises, quite a good, even in sports persons will see, or with the masturbation, or with relations with other people premaritally. What happens is this membrane gets torn or widened out, and people do approach with the fear that the husband may know this, that the hymen is not intact. They do approach us for the tightening of this membrane. So that is called hymenoplasty. So this is the membrane rejuvenation, that is hymenoplasty. So what we do is basically this. In this, we try to cut the edges, torn edges, and then resuture them or narrow the gap. We should not close the membrane totally, because otherwise what happens is the normal menstruation contents, they do not come out. So we go close it partially only. That is the back part of it, not the front part of it. If you try to close the front part, what happens is it may injure the normal urethra also. So this is a membrane rejuvenation. Then the third one is the vaginal rejuvenation. That is the vaginal rejuvenation is that is the cavity, actual cavity. That is a long linear cavity, which varies in dimensions in different people, different ethnics, or depending on the height also it varies. So this vaginal becomes in younger people, especially those who have relations with males, and who has premarital sex, and then or with what do you say, those who use, in fact in the West countries, what they use in sex toys also, which may with large sex toys. What happens is, because of that, when the vagina stretches significantly, and they will not have pleasure in the normal intercourse. So with that fear, with that, for that also they do come. And those who have premarital relations, with the fear that the husband may know that it is lax, and he may recognize that she might had some premarital sex, they also do come for this vaginal tightening procedures. That's called vaginal tightening of the vaginal cavity. This vaginal tightening can be done by non-operative methods and operative methods. And some of the best are, actually I can say, non-operative methods. One is like laser or radio frequency, or other methods are there, the tightening, which is especially useful when they have some amount of associated infections also, they're useful. Whereas for those who are whose vagina is very lax, especially after multiple deliveries, or episiotomies we call them, cut the vagina during the delivery process because of the large baby, people do require a surgical repair. What we do is, literally we take out a piece of mucosa, that is the thin layer that is inside the covering layer, and then try to suture from back to front. So this is called vaginal tightening procedures. So all these three complete the vaginal or female external genital rejuvenation process.